Ketamine mechanism of action. Ketamine inhibits NMDA receptor. Ketamine functionally dissociates sensory impulse from the limbic cortex. These state of dissociative anesthesia may cause the patient to appear conscious. Patient is able to eye open, swallow, and able to contract the facial muscles. Limbic cortex, the function of limbic cortex is it involves with the awareness of sensation. Now the use of ketamine has effect on mood, and ketamine are now widely used to treat treatment resistance depression, particularly when patient has a suicidal ideation. A small infusion dose of ketamine is used to supplement the general anesthesia opioids both during and after the surgical procedures. Low dose infusion of ketamine have been used for analgesia. Basically, the low dose infusion of ketamine can be used for analgesia. Ketamine is used for IV induction of anesthesia, particularly when the patient is hypovolemic and in trauma condition. Basically, the ketamine is able to produce sympathetic stimulation. That's why it is able to increase the BP, increase the heart rate. So it is useful in hypovolemic condition. Ketamine can be used intramuscularly. The route of administration of ketamine can be by the intramuscular route for the induction of general anesthesia in patients such as children and uncooperative patients. Ketamine can be combined with other agents in a small bolus dose for infusion for conscious sedation during the procedure such as nerve block and endoscopy. Subanesthetic dose of ketamine can cause hallucinations. Pharmacokinetics of ketamine. Ketamine, the route of administration of ketamine can be orally, can be nasally, can be rectally, can be subcutaneously, and can be epidurally. Distribution of ketamine. Ketamine is highly lipid soluble. It increases cerebral blood flow. It increases cardiac output. Due to increased cerebral blood flow, increased cardiac output, resulting rapid intake of ketamine by the brain and subsequent redistribution. Awakening from ketamine anesthesia is due to redistribution from brain to peripheral compartment. Biotransformation of ketamine. Ketamine is biotransformed in the liver to several metabolites. One of the metabolite of the ketamine is norketamine, that is also having anesthetic activities. Repeated dose of ketamine, patient can develop tolerance. Repeated dose of ketamine in patient can develop tolerance due to hepatic enzyme induction. Now the doses of ketamine for the induction, the IV route we can give 1 to 2 mg per kg ketamine. For IM route, the dose of ketamine is 3 to 5 mg per kg. For the maintenance of anesthesia, the infusion dose of ketamine is 10 to 20 microgram per kg per minute. For the analgesia or sedation, the dose of ketamine is 2.5 to 15 microgram per kg per minute. Excretion, the end product of ketamine is mainly excreted through renal system. Effect on organ system. The cardiovascular system. Ketamine increases blood pressure, it increases heart rate, it increases cardiac output due to stimulation of sympathetic nervous system. So it increases heart rate, it increases blood pressure, it increases cardiac output, and it also inhibits the reuptake of norepinephrine. One is direct stimulation of sympathetic nervous system, another one is inhibition of reuptake of norepinephrine. These are the factors responsible for increased blood pressure, increased heart rate, and increased cardiac output. Ketamine should be carefully That's why ketamine should be carefully used in patient with coronary artery disease. May that Due to increased heart rate, increased blood pressure, it may precipitate coronary artery disease, and it can worsen the hypertension. So we can carefully use ketamine, and it can be used carefully in congestive heart failure also. And fourth one is arterial aneurysm. In this condition also, the ketamine use should be cautiously very cautiously we should use ketamine. Respiratory system. Ventilated drive is minimally affected. That means ketamine does not depress the respiratory system. That's why the ventilatory drive is minimally affected by ketamine. Racemic ketamine is potent bronchodilator, so it can be the induction agent of choice in asthmatic patient because it causes bronchodilator. The increased salivation by the ketamine can be attenuated by the anticholinergic agent like glycopyrrolate. Now the effect on cerebral system. Ketamine increases cerebral oxygen consumption, increases cerebral blood flow, increases intracranial pressure. So, if there is a higher side of high intracranial pressure patient, we should avoid ketamine. Drug interaction of ketamine. Ketamine interacts synergistically with volatile agent. Means it both volatile agent and ketamine action act as a synergistic manner. Interaction with other drugs like benzodiazepines, propofol, and GABA receptor mediated agents. It is giving the additive effect on these drugs like benzodiazepines, propofol, and GABA receptors agent. Known depolarizing neuromuscular blocking agents are dose dependent but minimally potentiated by the ketamine. Means non depolarizing neuromuscular blocking agents are dose dependent, but ketamine can potentiate the non depolarizing neuromuscular blocking agents. Diazepam or midazolam attenuate the ketamine cardiac stimulating effect. Diazepam prolongs ketamine elimination half-life.